Good morning, everyone, and thank you all for taking the time to join me as we provide an update on the status of COVID-19 in East Baton Rouge Parish. Over the last few months, our community, like communities across the state, has celebrated our comeback. We've gone back to seeing our friends and loved ones, back to the events and places we know and love, and back to some sense of normalcy without intensified mitigation measures. I know that I, like so many of you, are grateful to have had this opportunity to connect with all things Baton Rouge. I want to ensure that we can continue on this path. We can continue seeing loved ones and continue doing the things that we love. We can't do this without the commitment of our community. As you may have heard, COVID-19 cases are on the rise once again. We are now in our fourth surge. Let me repeat that. We are now in our fourth surge. And we've been here before. We've seen cases and hospitalizations rise and fall. But I must say that this time is different. When we saw spikes last year, we did not have a vaccine. Our best defense were masks, hand washing, and social distancing. Now we have a vaccine that works with our immune systems to prevent severe outcomes, like hospitalizations or death. Despite these effective vaccines, hospitalizations are on the rise. From June 18th to July 18th, COVID-19 hospitalizations have nearly tripled. Numbers indicate that we have not seen this level of hospitalization since February, which was before the COVID-19 vaccines were widely available to our community. We have come such a long way since vaccine distribution began, but our community cannot afford to stop there. We have not yet reached the end of this pandemic, and our unvaccinated friends and neighbors are seeing the repercussions firsthand. We have to do better. We have to work together to increase vaccinations. Lives depend on it, and it's that simple. And as you've heard from the Louisiana Department of Health, and by the way, Dr. Don Marcel from the Louisiana Department of Health is here with us today, 97% of COVID-19 cases and COVID-associated deaths in Louisiana have been among those who were not fully vaccinated. 97%, let me repeat that. As we talk about percentages, I want to run a couple of them by all of you. As of yesterday, roughly 40% of East Baton Rouge Parish has completed their vaccination series, and roughly 44% have initiated their series. Now, you all know that we do have a contest with vaccinations with New Orleans. New Orleans is up to 50% with their completed vaccination series. We are up to 40%. And as all you hear from our doctors who are here today, many of the people we are seeing in our emergency departments and hospitalizations are young. They're unvaccinated adults. If you look at vaccination rates, it's easy to see why. Only 23% of 18 to 29-year-olds are fully vaccinated. This group represents the largest portion of our parish's population, and the majority of them are unvaccinated. And only 39% of 30 to 39-year-olds have been vaccinated. The solution is clear. The COVID-19 vaccine definitely saves lives. Receiving your vaccine is easy. I'm standing in front of our free community vaccination site at the Mall of Louisiana. where we are administering Pfizer vaccines to everyone who is eligible. It's quick, it's easy, and it's one of the dozens of vaccination locations across our parish. Our team takes walk-ins and they take appointments. You can get yours and make your reservation to get yours at brla.gov, get vaccinated. That's brla.gov/get vaccinated. Receiving your vaccine can prevent illnesses, hospitalizations, and death. We don't want to revert to the times where our hospitals were over capacity, where people could not receive the care they needed, and where we were losing our friends and loved ones to this virus. And let me just say that we are trending in that direction. Many of our hospitals are reverting their visitation policies and preparing for increased hospitalizations. But we know, I'm no medical professional, and that gathered doctors from across our community to give you more insight on the reality of this situation. And I encourage you to consider the perspective of those who have served our communities on the front line of this pandemic for over a year now. I hope we can all listen to them, that we can learn from them and take the actions necessary to protect the residents of our parish. With us today are Dr. Russo from Ochsner Hospital, Dr. Marcel, as I said, from the Louisiana Department of Health, and I'm going to introduce Dr. Titania Saavedra from the Baton Rouge Clinic. She is going to discuss the Delta variant. She will be followed by Dr. Louis Minsky from Baton Rouge General and Dr. Michael Bolton from Our Lady of the Lake Hospital. Dr. Saavedra.
Thank you, Mayor Weston Broome. I wanted to discuss the Delta variant because it is now the most common circulating variant that's causing disease. So a little bit about it, in case most people don't know. When we have viruses, what can happen over time is they can mutate and change. And they can change in various ways. Some of them might change how they attach to the cell to cause infections. Some of them may change how you respond to different therapies, or some may change with regards to how infectious they are, how contagious they are. Unfortunately, what we're seeing is the Delta variant is the dominant variant, not just here, but across the United States. We first saw it in India, then in the UK, and it has made its way here. Unfortunately, over the last probably 30 days or so, what we're seeing is an uptick of infections up over 140% and over 30% increase in deaths with this variant. This variant is highly infectious. So whereas our original COVID virus, or the SARS-CoV-2 virus that causes COVID, that virus, if you were infected with it, the likelihood is that you would infect anywhere between 2 and 3 people. To kind of put it in perspective, the Delta variant is so contagious that one person can infect upwards of 8 or 9 people. What we do know is that when patients are infected with it, they have a much higher viral load, meaning that they have much more virus present in their nasal cavities, in their airways, and that's why it's so infectious or so contagious to those around them. The best defense that we have against this variant, and hopefully all upcoming variants that we will see with this virus, is vaccination. I want to remind everybody where we were about a year ago, or even a year and 3 months ago, when we were on lockdown and we had no other things than masks, social distancing, and hand washing. We now have a very effective vaccine. We're talking effectiveness upwards of 96%. All we could say a year ago was that this pandemic was not going to end until a vaccine is available. it's available now. And I find it disheartening that we have such low numbers of vaccination rates. So I urge you, for the sake of your own family, your loved ones, the elders of your community, everybody that you hold dear to your heart, by vaccinating yourself, you're continuing to protect those people as well. And so I just urge you, not just for the Delta variant, we're going to see more. This virus is not going to go away. We never thought that it would. But we have a lot of data, we have more information about it, and we know the things that work. And vaccination is definitely one of them. So, thank you.
Thank you, Mayor President Broome, for having us here again. This is a number of times now that we've met in this situation, and we're really going to have to stop doing that. We are in our fourth surge, and what I've been asked to speak about today was the younger population and why. We've heard about the vaccination rates. I'll repeat some of those vaccination rates because it's worth hearing again, so that as a community we can make an educated decision, an informed decision on why or why not we would choose to accept the vaccine. 43% of our older population have been vaccinated versus 23% of the younger population as a general rule across our entire segment of population. As a result, we're seeing numbers increase in our younger people as well as our pregnant women. Half of the COVID patients that come to the emergency department at the Baton Rouge General have been under 40. 25% of those admitted to the hospital are also under the age of 40. And 2/3 of our patients admitted to the intensive care unit are under the age of 50. That's very different than our numbers 1 year ago or even 6 months ago we were in our third surge. It parallels, if you see, the vaccination rates, along with, as Dr. Saavedra has already said, the vaccine or the virus has mutated, it's changed, not only its appearance, but how it affects us, who it affects, and the symptoms that we have. It also is the explanation why, if you had COVID last year, you are not protected against the Delta virus this year. We are already seeing many sick cases, patients who are very ill, who had COVID last year, did not think they needed the vaccine, and now they're succumbing to the Delta virus. We know that vaccine heightens the immunity much better than an active case of COVID, and that's why it is so important, and it is why we have recommended that if you had COVID, you still should be vaccinated as soon as you've recovered because of that immunity. So far, the vaccine is able to cover all of the variant strains that we have right now. One day it may not, but we'll worry about one day when we get there. Today we really have to stomp out the fire that's feeding our community right now. The vaccine has been out just over a year. We have ample data to support its safety as well as its efficacy. You heard upwards of 96%. Have there been some side effects from the vaccine? Absolutely. But they've been manageable for the most part, and they're not very different from other vaccines that we've seen historically over many years in medicine. Our kids are ready to go back to school. Last year, we saw our kids not go to school. We saw our kids pulled in and out of school. We see our kids quarantined for 2 weeks because they were exposed. Maybe. We see our kids sent back to school. These kids not only need an education, but they need the social and developmental skills that they learn in school. It's important that our kids go back to school. And one of the best ways that we're going to do that is through vaccination. We don't have vaccines for under 12. Masks still work. Masks are still preferred, and masks will work. We don't want to mandate. I know there's a lot of parents, there's a lot of students who would prefer not to mask the kids at school, but it's effective and it's easy enough, especially if it means keeping our children at school so that they can get their education and they can obtain those very important social skills at this very young age to grow up to be productive, smart, intelligent adults and have the coping mechanisms for life that they learn in school. So there's so many ways that COVID has touched the young people in our population, in our society. And while Baton Rouge is doing very, very good relative to some, we're still not good enough. So I encourage you all, if you're eligible, at least think about all of the reasons you should get the vaccine before you make that definite decision not to. Thank you very much for your time.
Hey, good morning. Thank you, Mayor President Broome, for the opportunity to speak today. I wanted to touch on 3 viruses that we see in children. One being influenza. Our most recent flu season was one of the most mild we've seen in many years. Most of that due to the mitigation efforts put in place for COVID-19, mainly mask wearing and physical distancing. It also helped that we had one of the highest flu vaccination rates in recent years. The second is respiratory syncytial virus, also known as RSV. This is one of the leading causes of hospitalization in all kids. Typically this happens during winter. However, down the road at our children's hospital, our walls are busting at the seams with kids who have RSV. Part of that is due to the repeal of mitigation efforts for COVID-19, mainly less mask wearing and less physical distancing. These 2 viruses alone, RSV and flu, are the reason many providers call pediatrics a winter sport. And then if you add in the Delta variant of COVID-19, I worry what our winter is going to look like for our children, our community, and our hospitals. The third is COVID-19. We are seeing more kids at our children's hospital with COVID-19. We are seeing more kids in our ICU with COVID-19. We've given more antivirus medicine in the past 6 weeks than we have in the past 6 months for the severity of illness for our kids. And this is preventable. Similar to the flu, this is a preventable illness. The ability for us to have our prayers answered to get a miracle vaccine that we were asking for last year has been delivered. I'm going to try to reference it to something we all understand, LSU football. Imagine this vaccine is the keys to the kingdom. We are at the gates and we refuse free entry to the kingdom because St. Peter is wearing a McNeese State football jersey. Not an Ole Miss jersey, not an Alabama jersey. But for my fellow Louisiana citizens who have not been vaccinated, if you choose not to get vaccinated to save yourself, please do it for your grandmother, for your aunt, for your best friend. Please do it for those who are most vulnerable. Your kids, your niece, your grandson, they cannot get the vaccine. They depend on you to make the right decision to save them from this pandemic. The vaccine is the only way out of that. Thank you so much for your time.
Thank you all for giving us more insight on the Delta variant, the state of our hospitals, and the urgency for the vaccination of our younger population. Our biggest ask of our community is for everyone to go get vaccinated. 3 words: go get vaccinated. I know some of you may not listen to me or even to the medical professionals gathered here today, but I'm going to ask you that you at least take the time to discuss vaccination with someone you trust. Now, I don't mean your Facebook feed. That's not what I'm talking about. I'm talking about medical professionals like you see here, your doctors, your nurses, your pharmacists, or even someone who has been vaccinated. And if you have been vaccinated, take the time to reach out to your loved ones and encourage them to get vaccinated. Because as we've all said before, vaccination is the best tool to protect our community. It can prevent severe illnesses, hospitalizations, deaths, and the emergence of new variants that we are not equipped for. You all know we have worked so hard to move past this point. Our doctors, our nurses, our medical aides, our pharmacists, and countless others have worked so hard to get us to where we are now, and we thank them. And we owe it to them to not go backwards. I can't think of anyone who wants to go back to where we were this time last year. We all want to continue to move forward. We owe it to the people that we've lost. We owe it to those who are still recovering. And we owe it to our youth who are not old enough to receive their vaccine. We owe it to them to go get vaccinated. With that being said, we'll take a few questions.
Mayor, Brent became the first government agency this morning to require proof of vaccination to not wear a mask indoors. Are those discussions happening in City Hall? Is that a route that maybe not considering right now?
So the question was that BREC has now required mask vaccination, proof of vaccination for people who are in their facilities. And I will tell you, as the variant increases, I believe that all entities will probably have some level of conversation. We have within city parish government a task force that continues to discuss the impact of COVID-19 on our population. We have not had that conversation yet. I am hoping that people will do what needs to be done, and that is get vaccinated. Yes.
Mayor, we've been having this same conversation for more than a year now. However long we've had the vaccine now, but it seems like we've only been able to make marginal progress here. A, why do y'all think people are still so hesitant to get vaccinated? What do we expect to change now that will all of a sudden make people go get vaccinated? I mean, it just seems like we haven't made much headway or progress on this.
Well, we're at 40% of all people here being vaccinated. That's progress. We're at 44% of people having at least one shot. That's progress. Do we need to grow our numbers? You're absolutely right. We do need. I could probably list several obstructions to people getting vaccinated, but our message has to be an ongoing message of imploring, of encouraging, of stating the facts of where we are, of giving updates that will hopefully trigger or serve as a catalyst for at least 1, 2, 3, 4 people who may be seeing this today to say, you know what, I just need to go get vaccinated. There may be some people who recently passed or died because they did not have the vaccination. Maybe that family now understands the severity of it, and they're going as a family. So we have to continue to put out the message of the importance of getting vaccinated, no matter what the numbers look like, and believe that this message will continue to move people forward towards vaccination. We all know that there's been some, politicization around vaccinations, and that's unfortunate because it doesn't matter what political party you are, you can get COVID-19. And we want to save people from the dire results of this new variant. It's no respecter of persons. Yes.
So, speaking of not wanting to go backwards, is there a certain percentage of positive cases that would need to be in this area to us to move back to maybe shutdowns or other furniture restrictions?
Well, as I said, we continue to have ongoing conversations with our medical community. We are not at that point yet. As you know, I don't think there's anybody who wants to go backwards, but if we get to a point where things are just out of control with the COVID-19 variant, then we have to look seriously at all options. But my goal for having this today is to encourage and implore people that we have to get vaccinated so we don't go backwards to where we are. And so, most importantly, the severity of this vaccine. We don't want to keep losing people in our community. That's so vitally important. You've heard what the doctors have said today, and that should be convincing to everyone of the need to go get vaccinated.
Mayor, when it came to restrictions, they were also politicized when it was happening.
Correct.
And people didn't start doing it until it was being mandatory. Had to wear a mask. When are we going to get to the point to where we have to make vaccination mandatory as well?
Well, that's a good question about making vaccines mandatory. I believe that it's more of a challenge to make vaccines mandatory because of a variety of issues, as you well know. But I do think that we have to use the tools that we have, like wearing masks, like social distancing, all of those tools that we always have used. But mandatory vaccinations, I believe, would are a very complicated issue when you talk about an entire society and community. Now, with that being said, there are individual entities that are saying, whether they're a company, whether they're a restaurant, they have the ability to require their employees to be vaccinated to protect the workplace. So that is happening in some areas around our community.
Any other questions, guys? Anything from the doctors? Go ahead, Dan.
We can expect to hear from these back in their schools in a couple of weeks to see what they're going to do going forward with back to school, wearing masks. Anything to say to those officials right now who are trying to figure out what they want to do?
Yeah, my message to everyone is, the young people that can get vaccinated, who meet the age requirements, I encourage their family and their parents to consider them getting vaccinated. And at the end of the day, we have to do everything that we can to mitigate the impact of this COVID-19 virus on our students.
Maybe for the doctors, talking about the children, can you talk a little bit about the uptick that we've seen? How much of an uptick have we seen with cases among young people, let's say juveniles? And is this vaccine push really at a point where to get vaccinated to protect the kids that are under 12 that can't get that protection yet? I mean, is that really kind of where we're at?
Yeah, it's a good question. So, so kids under 12 cannot get vaccinated at the moment. There are trials ongoing, including at many of our institutions, where we're making sure that the vaccine is safe and effective for those youngest kids. So at the moment, the only protection the youngest, most vulnerable people have in our community is for us adults to get vaccinated. As you've heard from my colleagues, this is a very safe and effective vaccine, one of the safest and most effective vaccines that have ever been developed. It's what happens when you get a global team of scientists and an inordinate amount of money together to make this happen. And this is beyond our wildest dreams, so it's very successful. The issue becomes with the Delta variant, as you heard Dr. Savidra say, the transmissibility of it is extremely high. That includes in kids. And so when we have kids who are about to go back to school, as we get ready for winter with flu and RSV season continuing and starting, we worry about the number of cases that we're going to see in kids, especially those who are unvaccinated.
As far as the cases among kids, I mean, we've heard there's an increase. I mean, can you kind of put that into the picture? Like, are we seeing a dramatic increase in children coming in?
Yeah, I don't have specific numbers for you. All I can tell you from our institution, we are seeing more kids in the hospital with COVID-19. We are seeing them sicker. They are in the ICU, and we are having to give them more antivirus medicine, which we didn't have to do as much in the past because of the severity of their illness. And so we are seeing more of that. I apologize, I can't speak to the total number of kids we're seeing in the community who have that. I don't know if Dr. Marcel or someone else can get you those numbers. Yeah, it varies between 6 weeks old and 17 years old we've had in our children's hospital.
Regarding the pediatric population, I would like to reiterate that children are in fact contracting COVID-19. They always have, but this Delta variant is greater in numbers and also greater in severity of illness in this group. And I think it's important to remember that they remain contagious even if they aren't ill. And as of today, only the Pfizer vaccine is approved for emergency use in children down to age 12. And so we have other vaccines we're still waiting on emergency use approval in addition to results of studies that demonstrate, document, or prove the safety and efficacy in children younger than age 12. And so when we look at going back to school in elementary school in general, that's nobody, right? For school-age children. And then it's a significant number of middle school-age children who still aren't eligible for the vaccines that are currently available for emergency use. And so it's important that even though we now have the vaccine available, relatively widespread for those to whom qualify to receive it, we still have a significant number of people, our children in our communities, who are not eligible. And in addition to the vaccines, we continue to recommend the public health mitigating measures that we have always recommended from the start, including our masks, sanitizing, hand washing, and social distancing. Of course, some of those recommendations and guidelines have been modified since the advent of the vaccine and its availability. However, at the core, we still have to use these measures until the vaccine is truly widespread. And I would also like to mention that the American Academy of Pediatrics formally made a statement recommending the use of masks in children down to 24 months of age or 2 years old, regardless of vaccine status in all children. And so I think that's an important parameter to remember as well. And yes, they are getting ill, and in addition to just seeing cases that don't always warrant hospitalization, when it does, it can be really, really serious. And MIS-C, or multi-inflammatory systemic syndrome in children, is real. We have seen it in Region 2 and across the state in Louisiana. And it's important for us to realize that that is real and it is out here. And the percentage may be low, but if it's you or your child, it's 100%. It doesn't matter however many people may not get it or how unlikely it is, but the point is you can. And when it's yours, it's really important to remember that. And what I'd also like to say, and to just reiterate, is we share this information to inform you. We share this information so that when you are deciding whether or not a vaccine is right for you or your family members, that we have given you the best information and the most information that is available to us so that you can make an informed decision. As of now, vaccines are not mandated, and we hope that we put you in a position to make an informed decision to choose what is best for you, for your family, and for our community. And lastly, I want to be clear that the information that we provide is to inform you. We do not want to alarm you, cause fear, or contribute to any type of political divisiveness or any type of imposition on decision making. What we want to do as physicians and nurses and people who have committed our lives to learning about medicine to keep people well and safe and healthy is to give you the information we have to make a decision to keep you and our community well. Thanks.
Thank you, everyone. I think we'll end it there.
I do want to say one last thing, Mark. I want to thank once again our medical professionals for coming out today. I want to thank all of you all, and just want to reiterate, this is not a mandate message. This is a go get vaccinated message. So remember that, and encourage everyone in your sphere of influence to go get vaccinated. Thank you very much.